Have you or a loved one ever been to the hospital? The person that checked your vitals, gave you more pain medicine, and discussed your treatment plan with you is actually a nurse. Have you ever heard any of the terms ASN, BSN, MSN, or DNP? These are actually all titles for nurses, and by the end of this speech, I guarantee that you'll know what all of them mean. Nurses are fundamental to our society, and without them, your trip to the doctor's office or the hospital would never be the same. Nurses have an irreplaceable job in the medical field, and by knowing what they do will help you respect and understand the career of nursing. I myself am a pre-nursing major here at Columbus State, and in about half a semester I'll be applying for the nursing program. I'm very excited. By the end of this speech, you will know what nurses do, the level of education required to become a nurse, and the different opportunities that nurses have to further their education. Now let me begin with just some of the tasks nurses complete during one shift. And I bet some of them will actually surprise you. In an article titled Nursing, published by World Book Incorporated Chicago in 2014, they state that duties of a nurse include bathing the patient, shifting and positioning the patient to prevent joint contractures, teaching the patient on how to better care for themselves, and also counseling the patient on nutrition. To begin the 12-hour shift that a nurse has, the first thing they do is talk to the nurse that was on shift before them. Then they must gather all of the medication for each patient. Keep in mind this has a lot of math involved, and there's actually a 4-hour class here at CSU designed specifically to teach nurses how to do this. It's called pharmacology. If you or a loved one have ever been to the hospital, you're probably familiar with the call light button. Whenever it's pressed, the nurse has to drop what they're doing and go help the patient with whatever he or she needs. In a research published by Zing and Huey, published by MedSurg Nursing in 2011, they've found that patients believe that when they press the call light button, it should be a top priority for nurses to come take care of them. So on top of everything else a nurse has to juggle, this is just one more thing they have to do. Did you know that nurses can assess a patient, create a plan of care, and carry out that plan independent from a doctor? This is called a nurse-managed protocol. Shaw RJ and his team have concluded that patients greatly benefit from said nurse-managed protocols. Now that I've told you some of the things that a nurse does during a shift, let's turn to my next point. What level of education is required to be a nurse, and what different types of degrees are available? Karen Mattern published in McGill's Medical Guide in January of 2014 that the knowledge explosion of this century has created very many specialties for nurses. As I said, I'm a pre-nursing major, and I'm seeking my Bachelor of Science in Nursing, or my BSN. This is a 4-year program that's designed to make the student more well-rounded. World Book Chicago Incorporated states that this program emphasizes bedside patient care, leadership, management, and research. So not only is the student getting knowledge in nursing, they're getting knowledge of the humanities, the arts, and the sciences as well. Now this differs from an ASN, or an Associates of Science in Nursing. This is a 2-year program that focuses more on the technical skills of being a nurse. However, both of these, the BSN and the ASN students, take the same licensing exam called the NCLEX, and they both get the title of being an RN, or a registered nurse. There's also an MSN, or Masters of Science in Nursing, or a DNP, or a Doctor of Nursing Practice, and these two both they emphasize on research and the preparation of nursing educators. Now that we've discussed the educational opportunities, let's turn to my final point. How can a nurse further their education with just an ASN or a BSN? In a journal article written by Drennan J., published by Blackwell Scientific Publications in 2012, they've established that students that try to further their education benefit in leadership and management capabilities. Now, there are many entry jobs for a nurse. A nurse can work in a clinic, a hospital, a doctor's office for the military, or in a school. There are very many things that a nurse can do with just an ASN or a BSN. But how can they further their education? I myself want to become a CNM, or a Certified Nurse Midwife. To do that, I first need to graduate with my BSN. Then I need to go back and get my master's, my MSN. And I need to get my NP, or my Nurse Practitioner license. Then I can go to midwifery school and get my Certified Nurse Midwife license. Another opportunity is if you wanted to become a CRNA, a Certified Registered Nurse Anesthetist. To do that, you first have to get your bachelor's, then you need to get your master's, and then you need to work in the ICU or intensive care unit for about 2 years, and then you can get your board certified to deliver anesthesia. In conclusion, I've covered many aspects of the career of nursing. I've done my job of proving how fundamental and irreplaceable nurses are to the medical field. We've discussed what nurses do, the level of education required to become a nurse, and the different opportunities that a nurse has to further their education. Next time you go into a hospital, I want you to pay attention to the nurses. Think back to this speech and remember all the things that they're doing for your loved one that you don't even see. Say thank you. A busy nurse having a bad day would love to hear that their work is appreciated.